And what advice do you have for centers that are trying to integrate all their sources of EP data into one location?
I would say I think two major things. Number one, work with the tools that you have. Ultimately, it's very difficult to say, hey, we want to incorporate this extra vendor, or we want to pull this in. I mean, there are always limitations in what you can and can't pull in. And so working with the tools you have is one, but partnering with an industry partner that is going to have a mutually aligned vision or help you meet your goals and work with those tools that you have. That's, I think, the second thing I would recommend. So for us, we knew these are the tools we have, this is what fits in our box. Who can we work with that plays nicely with these tools? Who talks to all these boxes? And so for us, that's how we made our decision.
You probably compared other EP integration systems out there, and what are some of the key differentiators that you were looking for and that you found in what you are using now?
I think on a personal level, the team that you work with, the people you talk to, I think we just had a good relationship with the team, and we were able to find that they were personally not just available to us, but also willing to talk to us and integrate on large and small features all together. On a practical level, it's also just who works with the tools we have. We use a particular EMR on the outpatient side, we have different EMRs on the inpatient side, and so we wanted someone who would be compatible with all the tools that we have already, and that's kind of how we made those decisions. If you use, for example, a PaceMate or another platform, it will pull in certain data from devices, but there's HL7 components in it that it won't pull in. So you kind of have to either manually set those in, or there's just blanks in those fields. And sometimes they're germane to what you're dealing with, and sometimes they're not. But again, having a platform that actually pulls in all those data, that's platform agnostic, so to speak, I think is huge. And that I think is somewhere where it matters.
Your old workflow, it sounded like it was a little cumbersome from your talk. So could you just kind of describe what you used to have to do?
Yeah, so I'll pick kind of a very tangible example. For ambulatory monitoring, we would place an order, it would have to go through central scheduling, then it would go to the patient, they would finally schedule time to come in. So there's already now a delay from the time your order was put in to when the patient gets the monitor by almost a month. Then from there, they would wear the monitor, turn it in, the results would be downloaded, it would have to be printed, set separately for us to interpret, but then it would still have to be manually scanned into two sets of charts, the inpatient and the outpatient side. And even then, it wouldn't be billed. We still had to physically dictate the monitor just because the billing system had to be captured a certain way to be able to be registered. And so that alone sort of adds a lot of time, a lot of inefficiency by the time it's done, by the time we read it, by the time you get the results and act on them. But more importantly, it's a lot of extra work on the physician, it's a lot of extra burden. So that was our old workflow, but by incorporating a new workflow like PaceMate, what we do is we order directly through the EMR. Because it's already built in and there's bidirectional compatibility with the API, it actually just pre-populates, it pulls in that data from the patient that's not having to be manually entered or punched in by the person applying the monitor. It's ordered, it's pulled in, patient wears the monitor, we apply it in the office, and then when that monitor is done, it actually will pull any tangible or discrete HL7 data points into the automated read for us. So it sort of almost pre-populates a lot of the relevant data, so then it takes us a lot less time to sort it or peruse it before we kind of sign the report or kind of amend with whatever our individual interpretation may be. So it took us from like an 8-stage step that was full of kind of delays and hindrances to kind of basically a 3-stage process. Order it, results come in, sign it, and then from there it's populated to the charts and ideally to automated billing too.
What is the value of having a comprehensive remote cardiac monitoring system that integrates wearable and implantable EP devices in one location?
Absolutely. PaceMate has been just an integral part of our device program, our device clinic, as well as my overall lead management program. It provides us invaluable information and real-time clinical data. Any trends or alerts with potential problems with the leads, I think we're able to identify that in real-time data. We're able to contact the patient, get them in. We're also able to leverage PaceMate's unique and wonderful integration with Epic, where they talk back and forth. Working on utilizing PaceMate potentially to help us flag patients that have any diagnosis codes or signs that may indicate that they have an infection and a device, so we can identify them earlier, act on them earlier, and really leverage both in Epic, the algorithms that help us do that, as well as our algorithms in PaceMate.
Is the integration with Epic seamless, and how has that helped?
It works wonderfully. So PaceMate, talking back and forth with Epic, it's able to pull down real-time information. It's really helped our device clinic also go through, identify patients that may need potential upgrades that we were previously under-recognizing, as we can get current ejection fractions in there, look at their pacing burden as well. Also look at a variety of different things with the device, as well as what's going on with the patient clinically.
Can you tell me a little bit about the onboarding process that you had with PaceMate?
It was really easy. It was one of the easiest things I thought that we had come across in terms of doing an onboarding of an IT system. We had tremendous support both at the institution and really from PaceMate. PaceMate made it really easy, almost turnkey.
And how does the system compare to the system that you're using previously?
Oh, it's much better now, especially from a billing standpoint. Things seem much more automated. There's a lot of checks and balances built into the system. It's been really progressive for us in terms of feeling that it's something we can continue to add, build on, and make sure that our billing is right, make sure our patients are followed up most importantly. I think that's the most important thing, to make sure that they are being followed on a timely, systematic basis and nobody falls through the cracks.
How is it to work with this company?
It's been great so far. Amazing people, just very impressed with how available they are and how easily that they made the integration process.
And what do you think the most impressive aspect of that software is?
I would say the ease of integration in obtaining all of the patients in the clinic that had devices that we needed to follow, taking that data bank, putting it into a system that's usable for us, teaching us how to use their system, and then their interpretations are second to none, and the billing process is just straightforward, easy, and nothing seems to fall through the cracks.
I've heard that you use PaceMate to auto-triage patients in clinics to aggressively reduce alerts. Can you explain how you've leveraged the system to do this?
Yeah, what we found at the very beginning was that we were getting a lot of alerts as we increased the program. And we found that many of those alerts were redundant or were non-actionable. By non-actionable, I mean we didn't need to do something that was clinically relevant. So we met with them, we went through the program, and we were able to get all of our clinicians, APPs and doctors, agree that we should move X number of alerts into a secondary box where we didn't have to deal with them except at the end of the report time frame. That reduced the workload that we had so that we could focus more on those individuals who had alerts that were clinically relevant and needed attention versus being spread thin in dealing with the multitude of alerts, most of which were not clinically relevant.
Tell me a little bit about your clinic, patient makeup, and what you needed for operability.
So we service Zanesville, Ohio area, and we have 7 counties that we serve in our facility. We have approximately 3,100 device patients. And they are the pacemakers, defibrillators, loop recorders, and biventricular devices. Probably the biggest factor was the Epic integration. Obviously, whatever system we chose, we wanted it to work with the current system. There are other vendors out there that offer that, but when we did our research, it did integrate so well with Epic and so seamlessly from the other people we had discussed it with and talked to that it was just sort of a no-brainer for us. Because it doesn't do a lot of good to have another system if you just have to work in another system and they don't talk to each other. No provider out there wants to have 10,000 different places to go, and so having something that would integrate and have that direction of information back and forth was probably the biggest benefit. Like you said, we don't have to go back and forth to the charts. We don't have to continually look for changes. But it was definitely a change for the better. We don't regret our decision. We would do it again in a heartbeat. We're very, very pleased with the system.